Is it possible to have a stroke and not know it? Indeed, you can experience what's known as a silent stroke, one that occurs without any noticeable symptoms or recollection. When we typically envision strokes, we conjure images of slurred speech, numbness, or impaired movement in the body. However, silent strokes manifest without such overt signs. In fact, they often go unnoticed entirely. Similar to ischemic strokes, silent strokes occur when blood flow to a portion of the brain is abruptly halted, leading to oxygen deprivation and subsequent damage to brain cells. The challenge with silent strokes lies in their elusive nature. This is because they affect areas of the brain that do not govern visible functions like speech or movement, making detection difficult. As a result, individuals may remain unaware that they've experienced a stroke. 2. Who is at risk of a silent stroke? Individuals at risk of a silent stroke typically include those with certain demographics, pre-existing conditions, and lifestyle factors. A. Demographics like age. The risk of stroke increases with age. Ethnicity. People of Black, Hispanic, and Asian descent have a higher risk compared to other groups. Gender. Men are more likely to have a stroke, but women are more likely to die from one. Family. History. A family history of stroke can increase an individual's risk. B. Pre-existing conditions like hypertension. High blood pressure is a common risk factor. Heart disease, including conditions like coronary heart disease, diabetes, which can contribute to blood vessel damage. High cholesterol, leading to atherosclerosis. Previous stroke. Having had a stroke before significantly increases the risk. C. Lifestyle factors, like diet. A diet high in salt, fat, and cholesterol can increase risk. Physical inactivity. Lack of exercise contributes to poor cardiovascular health. Smoking. Tobacco use accelerates clot formation and artery narrowing. 3. How can you determine if you've experienced a silent stroke? If you undergo a brain CT scan or an MRI, the imaging will reveal white spots or lesions indicating areas where your brain cells have ceased functioning. This serves as the primary indicator for doctors to recognize a silent stroke occurrence. Moreover, warning signs of a silent stroke can manifest in various parts of the body, often subtly and without the typical symptoms associated with a regular stroke. Here are some areas where silent stroke symptoms may appear. Cognitive skills, issues with memory, attention, or thinking processes. Muscle movement, temporary weakness or paralysis, particularly on one side of the body. Balance, sudden difficulty with coordination or balance. Personality or mood, rapid changes in mood or personality. Speech, problems with speech, such as slurred or garbled words. Vision, loss of vision, strength or sensation, which may be subtle. Consciousness, brief episodes of fainting or loss of consciousness. 4. Is it possible to prevent silent strokes? Absolutely. While detecting silent strokes can be challenging and restoring affected brain areas even more so, preventing them from occurring in the first place is relatively straightforward. Here are some proactive measures you can take starting today. 1. Manage blood pressure. Studies have shown that high blood pressure significantly increases the risk of silent strokes. Keeping your blood pressure under control is crucial in reducing this risk. 2. Stay active. Engaging in regular physical activity such as 30 minutes of moderate exercise 5 days a week can decrease the likelihood of experiencing a silent stroke by up to 40%. Being physically active also lowers the risk of stroke complications and leads to better outcomes. 3. Reduce salt intake. Cutting down on sodium intake helps lower blood pressure and subsequently reduces the risk of stroke. It's important to be mindful of hidden sources of sodium in processed and packaged foods. 4. Maintain healthy weight. Aim for a body mass index, BMI, within the normal range of 18.5 to 24.9 to lower the risk of stroke. 5. Control cholesterol levels. Keeping overall cholesterol levels below 200 milligrams per deciliter and ensuring HDL, good cholesterol, is 60 milligrams per deciliter or higher, and LDL, bad cholesterol, is under 100 milligrams per deciliter, helps mitigate stroke risk. 6. Quit smoking. Smoking is a major risk factor for both heart disease and stroke. Quitting smoking significantly reduces the risk of stroke and improves overall health. 7. Limit artificial sweeteners. Recent research suggests that consuming artificially sweetened drinks may elevate the risk of dementia and stroke. Opt for healthier beverage options. 8. Eat a balanced diet. Increase your intake of fruits and vegetables, aiming for at least 5 servings a day. A diet rich in plant-based foods provides essential nutrients and antioxidants that support overall health, including brain health. 9. Manage diabetes. Diabetes is a significant risk factor for stroke. Keeping blood sugar levels in check through proper management and lifestyle choices is essential for reducing stroke risk. By incorporating these preventive measures into your lifestyle, you can significantly reduce the likelihood of experiencing a silent stroke and promote overall brain health and well-being.